Hi guys, my name is Dr. Lee Sung. Welcome to my YouTube channel. What if I told you your mouth could be warning you about diabetes months before a single blood test shows anything wrong, and most people completely miss it? Right now, millions of adults over 60 are walking around with early metabolic changes happening silently inside their body, while the earliest signs are already showing up in one of the most ignored places, the mouth. Not in loud symptoms, not in sudden pain, but in small, subtle changes that slowly build day by day. Dryness that wasn't there before, breath that feels slightly different no matter how much you brush, gums that bleed more easily than they used to, foods that don't taste quite right anymore, small mouth sores that take longer to heal. And most people, they don't worry. They think it's aging or stress or just normal changes of getting older. But here's the truth. Your body rarely changes without reason. It speaks first, quietly, long before things show up in lab reports. And the problem is not that the signs are invisible. The problem is nobody ever told you to look here. So let's slow this down and really understand what's happening. After 60, the body's ability to regulate blood sugar becomes less efficient. Insulin doesn't work as smoothly as before. Cells don't respond the same way. And gradually, over time, blood sugar begins to drift upward. Not in a sudden explosion, but in a slow, quiet climb. And while that is happening, the body starts sending signals, not through dramatic pain, but through sensitive systems. And one of the very first places it shows up is the mouth. Because the mouth is alive with tiny blood vessels, nerves, glands, and constantly changing bacteria. It reacts fast to internal shifts. So when blood sugar begins to stay slightly elevated over time, even before diabetes is diagnosed, several changes can begin. Saliva starts to change. Blood flow to gum tissue becomes less stable. Immune response in the mouth becomes weaker. And the natural balance of bacteria starts to shift. And suddenly, things feel different. You wake up with a dry, sticky feeling in your mouth, even after drinking water. You feel like your breath changes, no matter how often you brush. Your gums start bleeding a little when they never used to. Your tongue or mouth feels slightly off, without explanation. And at first, you ignore it, because it's small. But small doesn't mean unimportant. It often means early. Now let's break this down further. One of the earliest signs is a change in taste. Sweet foods may suddenly feel stronger than before, or strangely dull. Some people notice a metallic taste that wasn't there previously. Others just feel like food doesn't taste right anymore. This happens because taste nerves and receptors can be affected by long-term changes in blood sugar regulation. And because it develops slowly, people adapt to it without realizing anything is wrong. Then comes something even more common: teeth sensitivity. Cold water feels sharper. Sweet foods cause discomfort. Teeth that were fine for years suddenly react differently. Most people assume this is just enamel wear or aging, and sometimes it is. But when sensitivity appears gradually across multiple teeth, it can also reflect changes in saliva composition and protective enamel balance linked to internal metabolic shifts. Then there's gum health. This is one of the most overlooked warning signs. Gums that bleed easily during brushing or flossing, gums that feel more tender than before, or gums that seem to slowly recede over time. Many assume it's just hygiene, but when blood sugar stays elevated for long periods, even slightly, it can weaken small blood vessels in the gums and reduce the effectiveness of local immune defense. That makes inflammation easier to trigger and harder to resolve. So gums may become more fragile, even if hygiene hasn't changed. Now, another major signal: slow healing inside the mouth. A small bite, a minor cut, a sore inside the cheek. Normally, these heal within days. But when the body's repair systems are affected by elevated blood sugar, healing can slow down noticeably. A sore that should disappear in a week may linger for 2 or 3, or keep coming back. That's not random, that's information. Then there are recurring patches or infections. Sometimes the balance of microorganisms in the mouth shifts, and in higher sugar environments, certain organisms can grow more easily. This can lead to white patches, discomfort, or burning sensations. And often, people treat it locally, without asking why it keeps returning. Then comes something many people dismiss completely: dry mouth. Not the kind that goes away after a glass of water, but a persistent dryness that keeps coming back even after drinking. That's because in some cases, it's not just hydration, it's saliva production. When blood sugar remains elevated over time, fluid balance in the body can shift, and salivary glands may not function as efficiently. And that matters more than most people realize, because saliva protects your teeth, controls bacteria, helps digestion, and maintains balance inside the mouth. When it drops, everything becomes more vulnerable. And finally, one of the most important and often misunderstood signals: breath changes. Not regular bad breath, but a persistent, slightly sweet or unusual odor that doesn't go away even after brushing. This can sometimes reflect internal metabolic changes, where the body begins producing compounds that are released through breath. And because it comes from inside the body, not the surface of the mouth, no amount of mouthwash fully fixes it. People often don't recognize it. They just notice something is off, and they compensate instead of investigating. But here is what matters most. None of these signs alone mean a diagnosis. A dry mouth can come from medication. Gum bleeding can come from hygiene issues. Taste changes can come from many causes. But when multiple signs appear together, especially gradually over time, they form a pattern. And patterns matter more than isolated symptoms. Because early metabolic changes don't usually shout, they whisper. And the earlier you hear them, the more options you have. The biggest mistake people make is waiting for obvious symptoms, waiting for numbers to become clearly abnormal, waiting for something serious enough to act. But by then, the body has often been adapting for a long time already. So instead of ignoring small changes, it helps to observe them, notice patterns, track what is new, what is different, what is persistent. And if several of these signs feel familiar, it becomes reasonable to get a simple blood sugar check: fasting glucose and HbA1c. Simple tests, but powerful information. Because your body rarely becomes unbalanced without first giving signals, and the mouth is often one of the earliest places those signals appear. So the goal here is not fear, it's awareness. Not panic, but attention. Because when you learn to listen early, you give yourself time to adjust, time to respond, time to understand what your body is trying to tell you. Aging is natural, but not every change should be dismissed as just aging without question. Sometimes it is simply communication, and your body is always communicating. The only question is whether you're paying attention. So here's your takeaway. For the next few days, don't ignore small changes in your mouth. Notice dryness, taste, breath, gums, healing. Write them down if needed. Watch patterns instead of isolated moments. And if something feels consistent, don't delay getting clarity. Because early awareness is not fear, it's protection. And if this message made you think differently about your health, don't keep it to yourself. Share it with someone you care about. Because one small piece of awareness can change someone's entire health journey. And starting today, the challenge is simple. Start listening to your body before it has to speak louder.